Welcome to my presentation and thank you for listening. My name is Lise Elliott and I'm a Senior Lecturer in Healthcare Management at Alliance Manchester Business School, which is part of the University of Manchester. This presentation is about a study that I conducted with community nurses, and it's an exploration of the work of those nurses through the lens of labour process theory. Welcome. So my study is an ethnographic study of, as I've said, community nurses within the English NHS, and it uses labour process theory to analyse those nurses' work. The nurses themselves were based in the community and administered IV antibiotics to patients within the community. These were patients that ordinarily, if the service wasn't available, would have remained in hospital, but were discharged and their treatment of IV antibiotics was continued whilst they were at home. So I thought it'd be really useful, before I went into the methods that I used in this study, that I provided an overview, a brief overview of labour process theory itself. It's a well-established theoretical framework that was initially conceptualised in the 1970s by Harry Braverman, and it was used to analyse and illuminate the labour process of workers, and it drew on Marxist theory. In the early days, it was used as a tool to analyse traditional blue-collar manufacturing work, but in more recent decades, it's been used in the analysis of so-called white-collar work, including service and caregiving labour. And the two references there are Sharon Bolton's work, where she has used labour process theory to analyse the work of nurses. My study was undertaken in a city in the north of England, and it was carried out over a period of around 5 months, and I undertook over 140 hours of field observations, which were spread over 22 individual nursing shifts. I also undertook semi-structured interviews with the 6 community nurses that participated in my study. And the data that I produced from this work were field observations and interview transcripts, and the data was obviously produced from them. This data was then analysed thematically and inductively, and the fieldwork itself was undertaken in 2016. Now, amongst a number of other things, my findings laid bare the mechanisms, or some of the mechanisms, that were used to control this group of workers, these nurses. And the mechanisms used were to extract labour power from each individual nurse. And that occurred, there were a number of ways that this happened and a number of forms of control, but the two that I'm going to focus on here were in the form of allocation of patients, and also the transfer of production problems in the labour process from the employer, which was the NHS Trust, to the individual nurses themselves. So the first one, the allocation of patients, was that each nurse was allocated a number of patients at the start of each shift, and the expectation from their employer was that these patients must be treated completely by the end of the shift. So unlike in other settings where patients are perhaps transferred to nurses on the next shift through a process of handover, these patients were allocated to the nurse and they must be treated, and that treatment must be finished by the end of the shift. So the other mechanism was the transfer of production problems in the labour process from the employer to the individual nurse themselves. And these varied, but were in some cases traffic disturbances. So you can imagine if you were travelling across the length and breadth of a city, that you are going to come across traffic issues. Some of them you may be aware of that you can't avoid as a nurse. Some of them may be completely unplanned and happened and you were not aware of them. Or there may be things like traffic diversions, which means that you take longer to move from one patient to the next. So these problems in production were owned by the nurse rather than the employer, and so that resulted in time being a very, very scarce resource. Sometimes these problems were clinical issues. I remember one example where a nurse found it really difficult on one call to find a vein in a patient's arm to administer the treatment, and that inevitably delayed them for the rest of the day, and that then had a knock-on effect as the day went on. So these were just two examples, the allocation of patients and that transference of the production problem to the nurse, that were mechanisms to control the nurses and also ultimately to extract more labour power from each individual nurse. In the previous slide, we looked at two control mechanisms that we used to extract labour from the nurses in this study. One was the allocation of patients and the expectation that all patients allocated to a nurse on a shift would be treated during that shift. And the second mechanism was the transference of production problems from the employer to the nurse, so that those problems and the time that they took were borne by the nurse themselves. Now, labour processes has highlighted that. We've used that theory to do that. But what are the consequences of those two issues that we've highlighted, those mechanisms? Well, one is work intensification and one is work extensification. Labour process suggests and argues that these are the ways in which increased levels of labour can be extracted from a worker. In this case, in the case of the nurses, there was elements of both. So work intensification is where a worker is paid the same amount of money, but they work harder in the time that they work, and so there's an intensification of the work. And I saw that manifest in the nurses through as it was manifest by stress. So you can see the quote there from Dale. let's say you spent too much time with one patient, then you're getting late to the next appointment. That one is a disadvantage for me. So Dale there was talking about the stress and the strain that was a consequence of trying to make up the time that had been taken because of some production issue in the labour process. Work extensification is the extending of work. So the extending of the labour of a worker, and that usually is in the form of extended hours, extended time of working, and this happened quite frequently with the nurses that I worked with as part of this study. And we can see that quote from Sam there. Most of us are just very conscious of how precious the time is, and we don't want to be staying over every day, which is what most of us are doing. So you can see there that there are two forms of extraction of additional labour power. One is intensification, one is extensification. In these nurses, intensification was manifest through stress and a hurriedness around the work, and work extensification was manifest by working additional hours and staying longer and staying after their shift really should have ended. So from the findings that we've looked at over the last two previous slides, I think we can draw I can draw a conclusion that labour process theory provides real beneficial insights into the labour process of the community nurses that were part of my study. I think it also provides us with an understanding of some of the mechanisms used to control this group of nurses and how those control mechanisms, one was around the allocation and expectation of the treatment of the patients, and the second one was around the transfer of any production problems, any production challenges, to be borne by the nurse rather than the employer. That those two mechanisms then, as a consequence, the nurses had to intensify their work had to be intensified, or they had to extend their work, or as I said, generally what they did was a mixture of both. And that provides us with a real insight into how these nurses, and perhaps more generally, how labour process theory can be used as a lens through which we can get some real insights and some real understanding of the work and the nature of the work of both nurses, community nurses in particular, and possibly used in a wider context within healthcare workers more generally. Now, labour process theory, as I've said, is very useful, but it's an often overlooked and perhaps somewhat unfashionable tool for the analysis of caregiving labour, and I want to suggest that perhaps shouldn't be the case, and that it should be used more frequently to understand and to highlight and to illuminate the work and the labour process of healthcare workers. In conclusion then, I want to suggest that labour process theory provides us with a really useful analytical tool that can give us really valuable insights into the nature of caregiving labour, and also in relation to the impact of this type of work on the workers themselves. I think it's a really useful theory and a really useful analytical tool that can be utilised by researchers to produce critical analysis of workers' labour. And I think that's particularly important in the current situation that we find ourselves in terms of healthcare, where we seem to be in a constant situation where our healthcare systems are organisationally stressed, and labour process theory seems to me to be a really valuable lens to which we can analyse the workers and the work within those stressed systems.